First of all, the most important principle of this bill is that it's paid for. We already had about $5 trillion of debt when the last president became president, and we're now at $12 trillion. It's been an unbelievable spike since 2000 and today. We have put an enormous burden, and as the father of 3 young girls, I feel this very personally and very keenly, an enormous burden on our kids and our grandkids. Our debt is now $12 trillion. Our entire gross domestic product, our entire economy is $14 trillion. Our deficit is $1.4 trillion, 12% of our gross domestic product. That is utterly unsustainable. And what we know is that the biggest driver of our medium-term deficit are our rising Medicare and Medicaid costs, and the biggest driver of those are our rising health care costs. This bill, unlike Medicare Part D, a very worthy program passed during the last administration, this bill is paid for. That drug program for seniors was not paid for. Instead of paying for it, instead of making hard choices, what we said to our kids and our grandkids was, you pay the bill. By the way, that's what we've said about tax cuts, that's what we've said about the wars in Afghanistan and Iraq, and we got to put an end to this. This bill at least starts to head us in the right direction. It doesn't fix our fiscal crisis, but it is an important step forward. As I mentioned a few minutes ago, for working families, the current system has been a complete disaster. As their income has remained flat or gone down, their health care premiums have gone up by 97%, and even though there's a lot of conflict out there about what the way forward should be, about what specific policy choice here versus a specific policy choice there, I can tell you one thing everybody can agree on in my state is that their health care has not improved by 97% over the last 10 years. They're paying more and they're getting less. Coverage is getting weaker as it gets more expensive. And by the way, one of the things that's really interesting to me about this debate over a public option is that people don't seem to understand what's actually happening today before our eyes. As the costs of insurance are going up every year, fewer and fewer people are able to get insurance through their employer. Fewer and fewer employers are able to offer insurance to their employees, which is heartbreaking for many of our small business owners because these are family businesses that for years have provided health insurance to their employees. They view it as part of their pact with their employees to help them get ahead, but they can't do it, so they're dropping them from the rolls. And where are these folks ending up that are now uninsured? Well, 2 places. Medicaid, if they're poor enough, or in the emergency room, getting covered with uncompensated care that we, the taxpayers, are paying for. We have a public option, it's just the least intentional and most expensive public option you can imagine. So we need to understand when we're talking about the changes that we're talking about here, we need to understand what's really going on in the daily lives of people all across our country. The figures that we've got from the Congressional Budget Office show that this bill will reduce the deficit, not add to it. We'll cut our deficits over the first 10 years by $130 billion, over the next 10 years by $650 billion. That's $780 billion. And you know, one thing we know about those numbers is they're not going to turn out to be exactly accurate. But here's the good news. The CBO is unable to score the benefit of prevention. They're unable to score the benefit of wellness. They're unable to score a focus on primary care instead of emergency room care. And there's a good reason for that, because that comes down to execution. How well is the program implemented? And those of us that are proponents of reform carry a very heavy burden to make sure that the execution is good and that we carry this through. But the good news is, if we do a good job, we'll save money.